Hello, my name is Ismael, and I am accompanied by my partner Maggie. And today we will be presenting you all a little bit about the cranial nerves. So, a quick introduction to the cranial nerves. They can be found branching from the medulla to the midbrain, or essentially within the brainstem, and even running below the frontal lobe, and are highly important asset to vertebrates. They are important in providing both sensory and motor function to the face, neck, torso, and other functions such as facial expression, balance, blinking, eye movements, and even movement of the tongue, along with other functions. Now moving on to the gross anatomy of the cranial nerves, abbreviated CN. So to the right, you will be able to find a complete brain and an isolated brainstem with the cerebrum removed. And this is just to show you the cranial nerves. And in the top, you will find all the cranial nerves in the whole brain, except for cranial nerve 3. And that cranial nerve can be identified in the bottom view that has the brain stem. And then now moving on to this left portion of it, we'll be discussing some of the general functions of the cranial nerves and where they could be identified. So cranial nerve 1 is sensory in nature, identified at the end of the olfactory tract inferior to the frontal lobe. Cranial nerve 2, sensory as well, identified superiorly to the pons and inferiorly to the frontal lobe. Cranial nerve 3 is motor in function, found at the cerebral peduncles and is positioned just inferiorly to the optic nerve. Cranial nerve 4 is motor in function, found on the dorsal surface of the brainstem below the inferior colliculi. Cranial nerve 5 is both motor and sensory in function and is found at the lateral pons. Cranial nerve 6, motor, found midline near the caudal pons. Cranial nerve 7, both sensory and motor, found on the lateral portion of the pons near the cerebellum. Cranial nerve 8 is sensory, found on the lateral portion of the pons near the cerebellum as well. Cranial nerve 9 is both sensory and motor and controls the tongue and pharynx. Cranial nerve 10 is found across the entire spinal cord, the lateral side, I believe, of the spinal cord. Cranial nerve 11 is found adjacent to the spinal cord, and cranial nerve 12 found adjacent to the medulla.
For this project, we examined and took pictures of the brains of 3 species in our lab, which include the human, horse, and sheep. And through dissection, which mainly involved the removal of the dura mater, we were able to obtain pictures that showed the ventral view of the brains and had mostly all of the cranial nerves present. Using cited literature, we were able to find pictures of the brain of a dolphin, which was our 4th species. With this information, we were able to compare the human brain with the horse, sheep, and dolphin brains. And then using further research, we found clinical studies involving the cranial nerves in the human brain, which will be presented later on. And finally, in figure 1 below, you can kind of see what the brain would look like before dissection, which is on the left, and then afterwards, which is on the right, and which show the cranial nerves. Now, moving on to the comparative anatomy, and as mentioned before, we are looking at the cranial nerves of the human brain and comparing those to the nerves of the sheep, horse, and dolphin brains. These nerves are very similar to each other in the different species, and the main way that is that they all have 12 pairs of them, each serving very similar functions. And basically, the motor and sensory nerves that we kind of explained in the beginning, which one was which, are all the same in each species. And cranial nerves serve a very great importance in everyday life for humans and all other animals. Some of the only differences come from what nerves are relied on the most. For example, like the sense of smell is far more important for animals than in humans. And the same would go for sense of hearing for dolphins. So now moving on to the case studies, starting at case study number 1, which involves cranial nerve 3. A 53-year-old woman was presented with 3-month history of headaches and diplopia. There was no history of fever, weight loss, or nocturnal sweating, and also no history of diabetes, hypertension, or any other neurological disorders. The neurological examination revealed a complete left oculomotor nerve palsy. Some of her symptoms that can be seen was droopy eyes, dilated pupils, and outward positioning of the left eye. An MRI scan revealed a homogeneous soft tissue lesion occupying the left sphenoid sinus, which was invading into the left cavernous sinus, which can be seen in figure 1 below. And the patient was diagnosed with non-Hodgkin's lymphoma. And after about 6 cycles of chemotherapy, the left cranial nerve 3 was completely resolved. Case study number 2 involves a 21-year-old male presented to the ER with head trauma of the left craniocervical region. Symptoms included slurred speech, hoarseness of voice, difficulty swallowing saliva, and left neck pain exacerbated by movement. Upon physical examination, it was revealed he had left-sided large cervical swelling, and cranial nerve examination revealed left-sided severe dysfunction of the cranial nerves 9, 10, 11, and 12. Other symptoms of note include asymmetrical elevation of the soft palate pulling to the right side, insensate left oropharyngeal wall, left vocal cord paralysis, and tongue deviation to the left. The patient was given steroids and analgesics and had regular sessions of neuromuscular rehab. And with these treatments, his slurred speech, hoarseness, and neck improved in 4 weeks. And after 6 months, he saw a full recovery.
Case study number 3, cranial nerve 7. So a 70-year-old man complains of progressive left facial palsy, unstable gait, and bilateral hearing loss. Physical examination revealed left facial paresis and gait disturbances with lateral deviation to the left. Stapes tendon reflex was present on the right, but not on the left. An MRI depicted below in figure 3 depicts large intracranial mass located below the right temporal with smaller ipsilateral tumors on the left, indicated by the black arrows in figure 3. And figure 3 is a coronal section of a T1 weighted MRI showing bilateral tumors below the temporal lobes. Moving on now to case study number 4, cranial nerve 8. A 66-year-old male was diagnosed with mycosis fungoides, a form of blood cancer. He started chemotherapy receiving the following treatments: cyclophosphamide, adriamycin, vincristine, and prednisolone. 4 weeks after the second cycle of treatment, the patient developed acute onset of bilateral hearing loss, left being much worse than the right, and associated new skin lesions. Cranial nerve examination revealed bilateral sensory nerve deafness, worse on the left than on the right. His Weaver test localized to the right side, and his eardrums were normal, with no other cranial nerve abnormalities. Contrast MRI and CT scan of the brain revealed no abnormalities, although lymphoma cells were detected in his cerebrospinal fluid. No other complaints from this patient. Below this, you can also now find our references to which you may find the associated papers that we read over and used in our presentation. Thank you.